This is Martin General Hospital in Williamston. It closed back in 2023 and it left thousands of people without access to health care. But now ECU Health has filed an initial proposal to be the provider that gets those doors back open. WRAL health reporter Grace Haba joining us now. And Grace, this would be kind of a first of its kind to do this in the state.
Dan, if you've gone to our North Carolina beaches this summer, there's a very good chance you've probably driven right by Martin General Hospital. Now, 2 years ago, if you and your family were in an accident on that route, you might have been transported here for life-saving care. Right now, that's not an option, but a historic effort is looking to change that. The sudden closure impacted people countywide.
It had a direct impact on my family.
One of them, Martin County Manager Drew Batt's wife, who was left with no other choice but to now commute 30 minutes one way to work somewhere else.
We're losing a lot of people from Martin County for that reason.
But this shuttered hospital in Williamston could soon make history in North Carolina. In a statement, ECU Health in Martin County confirming to WRAL, a letter of intent has been filed to potentially reopen Martin General as the state's first rural emergency hospital.
The concept, though, is most of the first floor could be reimagined as a rural emergency hospital.
Having somebody like ECU Health come and open the hospital back up as an REH will be a welcomed event for fire and EMS.
Beyond healthcare, the reopening could bring a much-needed financial boost to the entire region by attracting new clinicians and businesses.
ECU Health is a major economic driver in the eastern part of the state. This is a really big potential deal for eastern North Carolina in general.
While he stopped short of specifics, Batt says reopening the doors isn't without its challenges, stating ECU Health has outlined several things the county needs to do for this deal to move ahead.
It's a good step. I think we're all positive that it's better than not having taken this step. But we're at a point where we know there's a long ways to go, and all we can do is keep pushing forward.
And we all know just how vital time is. EMS officials there in Williamston tell me response times because of this hospital's sudden closure have risen from about 5 minutes to nearly 20. So reopening these doors, Ashley, could have a major impact.
Absolutely, Grace. Thank you.